Hello dear friends, welcome to PharmaGrid. So let's start with question number 26 of CAPS recalls discussion. Drug which increase serum creatinine without affecting glomerular filtration or glomerular function. The options are diazepam, trimethoprim, ceftriaxone, metolazone. Here the correct answer is option B, that is trimethoprim. The glomerular filtration rate is the main but not the single determinant of the plasma creatinine levels. Several drugs such as cimetidine, trimethoprim, corticosteroids, pyrimethamine, salicylates and active vitamin D metabolites have been reported to increase plasma creatinine without influencing its glomerular filtration. Next question. Boiled lobster rash is a characteristic of. The options are boric acid poisoning, organophosphate poisoning, hydrochloric acid, then chromic acid. So here the correct answer is option A, that is boric acid poisoning. In boric acid poisoning, the major symptom is erythema, desquamation and exfoliation. The skin of the patient looks like a boiled lobster. Next question. Insulin lispro, that is Humalog, is generally administered. The options are 1 hour after the morning meal, 1 hour after dinner, at bedtime, 15 minutes before a meal. Here the correct answer is option D, that is 15 minutes before a meal. This insulin lispro, which is known as the Humalog, is the most rapidly acting insulin available. So other examples for rapid acting insulins are insulin lispro, insulin aspart and insulin glulysin. This insulin lispro, its onset of action is about 15 minutes and its peak action occurs within 30 to 90 minutes. This form of insulin is generally given 15 minutes before a meal to permit effective utilization of the glucose that is absorbed. So all these kind of rapid acting insulin should be administered to mimic the prandial, that is the mealtime release of insulin to control postprandial glucose. These insulin should be administered in 15 minutes preceding a meal or within 15 to 20 minutes after starting a meal. Question number 29. A patient who is a slow acetylator of isoniazid is characterized by. Isoniazid is an anti-tubercular drug. The options are a predisposition to beta-lactam hypersensitivity, slow metabolism but normal therapeutic response, slow metabolism and reduced therapeutic response, slow metabolism and enhanced therapeutic response, peripheral neuropathy, that is resistant to pyridoxine therapy. Here the correct answer is option B, that is slow metabolism but normal therapeutic response. No significant difference in clinical response can be identified between patients who acetylate isoniazid slowly and those who do so rapidly. Although slow acetylators of isoniazid are more likely to develop peripheral neuropathy from the drug, they respond as well to pyridoxine therapy as rapid acetylators. Question number 30. The prolonged use of which of the following drugs is associated with the development of Parkinson-like symptoms? The options are rosiglitazone, N-kyanide, chlorpromazine, enalapril maleate. Here the correct answer is option C, that is chlorpromazine. This chlorpromazine is a phenothiazine antipsychotic agent that acts as a dopamine antagonist. With prolonged use, it can cause a variety of Parkinson-like effects. So this Parkinson's disease is due to the destruction of dopaminergic neurons in the substantia nigra. So what these antipsychotics will do? They will further block the dopamine receptors and hence they can cause a variety of Parkinson-like effects. So here the correct answer is option C, that is chlorpromazine. With this question, we have completed today's recall session. Thank you for watching this video. Have a pleasant day.